Now, the Nigerian Medical Association has issued a 21-day ultimatum to the federal government to resolve all outstanding issues relating to the ongoing strike by resident doctors or risk an escalation of the situation. The medical body has threatened to mandate its members to join the strike if nothing changes. And coming at a time that a third wave of COVID-19 has been unraveling, analysts say the prospects for significant improvement in healthcare delivery, especially for the most needy, continues to fade.
Joining us now to explore this bit more is Dr. NWACHUKWU OKAFO, a consultant, obstetrician and gynecologist, chairman and medical and dental consultants of Nigeria at the Federal Medical Center in Abuja, and also a member of the Council of the Federal Capital Territory chapter of the Nigerian Medical Association. Welcome, sir. So we hear.
Thank you. Good afternoon.
Good afternoon. It's quite unfortunate what is going on with this back and forth and the strikes. Can you give us your comments on what you see would be a positive outcome for all of this in the 21 days?
I didn't get you well. Please, could you repeat that?
I said, what do you see would be a positive outcome to come from this possible strike?
Positive outcome?
Yes. What would be a good outcome? What do you hope to happen positively?
Well, nobody loves to embark on a strike, especially considering the particular field we practice in. But circumstances most often constrains us to probably seek for an extreme measure to embark on a strike. So whatever the positive outcome may look like, it could be, most times our demands are often based on elements that will improve the health sector. Then secondly, accompanied that most often will be welfare of members of the health practitioners. So if the demands are met by the appropriate authorities, perhaps we could have better environment, infrastructure to practice like anybody's want to do in other climes.
Okay, Dr. OKAFO, you say if the demands are met, and some would say due to the serial occurrences of your strikes, if would be a capital, bold, underlined if. What's your plan B?
Now, this has been a recurrent factor because, like in the present circumstance where we have the National Association of Resident Doctors on strike, an affiliate of the NMA, an agreement was reached between the association and the federal government sometime in April. And following that agreement, it's been more than 3 months, 100 days, and the government never kind of reneged on their own part of that agreement. And that was what occasioned this relapse in the strike again. And we are hoping that probably the government will meet up with, if not all, some fraction or percentage of the demands, which we know are necessary. For instance, in this particular period when we have a pandemic, there are people who haven't been paid salaries for months. Of course, that wouldn't be fair, knowing that the remunerations for the present moment is one of the major factors why most of our colleagues are taking off, brain drain, traveling out of the shores of this country to seek for greener pasture. So I think it will be right that the government should look into some of the basic demands, which as a matter of fact should be the right of the doctor, sort them out, while we still forge ahead to look for ways of improving our health sector.
Okay, Dr. OKAFO, I don't want to sound like I'm repeating myself. Doubtless, the government ought to hold up to its side of the agreement, but government reneging on its side of the agreement is also a recurring decimal. So I'm asking again, what's your plan B?
The plan B of the NMA?
Yes, in the event that the government reneges or doesn't hold up to its side of the agreement.
The next meeting last weekend, the Nigerian Medical Association actually issued a 21-day ultimatum. And the ultimatum is basically not about a strike, to give the government some time to look at the demands again and sort out the problem with the National Association of Resident Doctors. The NMA is the parent body of all the medical associations, including the MDIC, and there are so many of them under NMA. So the NMA is kind of involved in some kind of brokering peace between the government and its allied associations. And it is our hope that before the 3 weeks elapses on the 18th of September, that the government would have come to terms with the striking resident doctors and probably do the needful. Then, if at the elapse of the time, the 3 weeks we've given to them, we hope to review the situation and decide to plan, maybe now tell you what our plan B will be. But at the end of the 3 weeks notice, there will be an emergency meeting to review what has been done so far regarding the strike.
Dr. OKAFO, it's very obvious that doctors go through quite a bit in this country to get their work done. Can you just go over with us once again what the basic demands of these doctors are, just so everyone's on the same page?
Okay, in as much as I'm not a member of the Association of National Association of Resident Doctors, but I understand that some of their demands will include outstanding salaries being owed to some of their members. We also have the issues relating to members who have remained as locum staff, temporary staff, what they call locum staff. Some of them have worked for years in that capacity as locum staff. Then probably other sundry issues may include the issue of the hazard allowance, which you all know is a paltry sum of 5,000 naira, probably in the neighborhood of $10, and so on and so forth. I think so.
Okay, could you just speak briefly, I don't know how much time we have, on the issue of victimization of those participating in the strike? We understand that Dr. Chris Ngige says no work, no pay, and he says it's illegitimate or it's illegal for doctors to expect to be paid when they don't provide themselves or present themselves at their duty posts. What's your take on that, briefly?
My own opinion on that is this. Nobody wakes up and decides to embark on a strike. And before a strike is called for, there must have been adequate notices, discussions. So if any organization should embark on a strike, having made every possible effort to avert such a strike and maybe have discussions with government for them to see reasons with them, then I wouldn't think it's appropriate in the trade union laws to hold their salaries back.
Okay, thank you very much, Dr. OKAFO, for being a part of Newsday. We wish you all the best and hope you can arrive at a point of resolution on this.
Okay, thank you.